In this video, let's discuss about anemia and its various types. Anemia can be defined as reduced hemoglobin concentration in the blood below the lower level of normal range for the age and sex of the individual. The normal level of hemoglobin concentration in male is 13.5 to 17.5 gram per deciliter, whereas in female the normal level is 12.5 to 15.5 gram per deciliter. As we know that when the hemoglobin concentration is getting reduced, obviously the oxygen carrying capacity of the blood is also getting lowered. In order to overcome this, our body undergoes some compensatory mechanisms, which are as follows. Initially, liberation of oxygen from oxyhemoglobin complex occurs. This is followed by increased blood flow to the tissues, maintenance of blood volume, and redistribution of blood flow to maintain the cerebral blood supply occurs. Patient with anemia commonly encounter symptoms like tiredness, generalized muscle weakness, lethargy, headache. In some older patients, we can also find the symptoms like cardiac failure, angina pectoris, and intermittent claudication. And when it comes to the signs of anemia, the most common sign is pallor on the conjunctiva and mucous membrane. People also encounter tachycardia, cardiomegaly, retinal hemorrhages, amenorrhea, mild proteinuria, and weight loss. On peripheral blood smear examination of anemic patient, we can find an isocytosis, which means variation in size of the red blood cells. An average diameter of the red blood cell ranges from 6.7 to 7.7 micrometers. Anisocytosis may occur due to the presence of cells which are larger than the normal RBC, which means macrocytosis, or presence of cells which are smaller than the normal size of RBCs, which means microcytosis. Sometimes there may also be a dimorphic condition where there is presence of both microcytosis as well as macrocytosis. Also, in the peripheral blood smear examination of anemic patient, we can find poikilocytosis, which means variation in shape of the red blood cell. The next characteristic feature seen in the peripheral blood film examination is hyperchromasia. Hyperchromasia means increase in pallor in the central region of the RBC. This may be due to less hemoglobin content or due to thinning of the red cells. Now let's move on to the classification of anemia. We got two major classifications of anemia based on their pathophysiology and their morphology. First, let's look at the morphological classification. Based on the morphology, we can classify them as microcytic hypochromic, normocytic normochromic, macrocytic and normochromic anemia. Based on the pathophysiology, we can classify anemia as anemia due to blood loss, anemia due to impaired red cell formation, and anemia due to increased red cell destruction. Anemia due to blood loss can be because of either acute hemorrhage or chronic blood loss. We encounter all the major types of anemia due to impaired RBC production. Cytoplasmic maturation defect leads to iron deficiency anemia, which arises because of deficient heme synthesis. It also leads to thalassemia, which is because of deficiency in globin synthesis. The nuclear maturation defect leads to megaloblastic anemia, which is because of vitamin B12 and folic acid deficiency. And also, aplastic anemia occurs as a result of defect in hematopoietic stem cell proliferation. The third type of anemia in the pathophysiological classification is due to increased RBC destruction. This may be a intracorpuscular defect or extracorpuscular defect. The intracorpuscular defect is hereditary and acquired, whereas the extracorpuscular defect is an acquired hemolytic anemia. And that brings us to the end of the video. I hope you guys found this video useful. Do like this video and subscribe to Medinare for more. Have a nice day.